I had 2 incidents of transient ischemia attack, which nobody explained to me why. And I had always suspected it was related to my heart condition, but no doctor back home was able to tell me why it happened to me. Prior to coming to Mayo Clinic, I was not able to talk for, say, more than half a minute to a minute. I would get out of breath. And, the basic inhaling and exhaling were just not so easy for me. And also, I could not walk and talk at the same time. And some days I would get lightheaded and I would get dizzy, especially every day at dinner. I would, say, have 2 bites of dinner and I would get so uncomfortable. I would, find it hard to breathe or tired, lightheaded, and I would have to lie down for about half an hour before I could go back to my dinner.
Hypertrophic cardiomyopathy is actually, we call it the disease of heart muscle, but it's a hereditary abnormality that can be passed on from family to family. The heart muscle, instead of dilating up, just becomes very, very thick. And when it becomes thick, there's a number of things that can happen. Number one, it doesn't fill well, so fluid can back up behind, causing shortness of breath. It can kind of obstruct the flow of blood going out to the rest of the heart, and it can cause heart rhythm abnormalities, which in themselves can be quite dangerous. Dr. Schaff has kind of perfected this variation of the myectomy by going in from the bottom, removing the muscle that's causing the problem, resecting the aneurysm. And with that has caused a significant improvement, results in significant improvement in symptoms in many of these patients who before really had no treatment that was known.
Back in Taiwan, there was no treatment, no effective treatment. Also, I saw Dr. Schaff's video explaining, the myectomy and the apical myectomy procedure, and I just said, I have to find this Dr. Schaff.
The procedure that was developed here was the transapical approach to the mid-ventricle and the transapical approach to remove the bulk of the apical muscle to enlarge the left ventricle. Dr. Nishimura and I had the first patient together that had that procedure at Mayo Clinic, and that's the procedure actually that Vivian Tsai underwent.
After the surgery, I am not getting any of the symptoms I described. No lightheadedness, no dizziness, and I find breathing so easy now. I think having lived for 40-some years, this is the first time in my life I'm feeling, gee, it's so easy to breathe. I am very grateful to Dr. Nishimura, to Dr. Schaff, and to the whole surgical team, and to pretty much everybody at Mayo Clinic. My experience here has been just miraculous.
She felt like that there was a lack of medical information, not only lay information, but medical information on apical hypertrophic cardiomyopathy and treatment. She's been very generous to us in supporting research at Mayo Clinic, and I'm sure that those research efforts are going to lead to more publications on hypertrophic cardiomyopathy that will get to physicians and make it more likely that they'll recognize that there's a surgical approach to the problem that Vivian had, as well as newer techniques for diagnosis and genetic diagnosis of the disease.
I came with hope, and when I came for surgery, my only goal was I want to be alive and well after the surgery. I think Mayo Clinic is a place that gives you hope, that delivers the hope that makes your life better.